Hello all, I'm Dr. Neema Bhat, consultant hematologist, hemato-oncologist, BMT physician and pediatric oncologist. I'm currently a senior consultant in Helios Cancer and Hematology clinics. I'd like to talk about the topic of ITP and is there a risk of life-threatening bleed with ITP? So is it a threat to life or risk to life? What is ITP? As I've described in my previous videos, it is nothing but low platelet counts because of overactivity of your immune system. So platelets are cells that help us to control bleeding and that sort of act like little ambulances that come to the spot of either injury or damage and form a blood clot and give some time to the body so that the body can make a blood clot to prevent any sort of bleeding. When ITP is diagnosed, usually platelet counts can range anywhere between under 10,000 all the way until more than a lakh. Normal platelet count is at least about 1.5 lakhs to around 4 lakhs. So is ITP a life-threatening condition? That is most often the question I get. And is it a condition that is going to last me for life? Yes and no. So is it a life-threatening condition? In most of the cases, ITP doesn't directly cause a threat to life. But if platelet counts are below a particular number, so as I described, if platelet counts are just below 1 lakh, so between 50,000 to 1 lakh, that's usually not a threat to life. As the platelet counts start becoming lower in number, so once it starts reducing to below 50,000, there is a slight increase in the threat to life. Especially when the platelet counts drop to less than 20,000, less than 20 or 10,000, then it becomes a higher risk to life, because this means that the patient with ITP is at a higher risk of bleeding, either in their abdomen or in the brain, which are usually the two most important places where if there is a major bleeding, then it becomes a very significant threat to life. And is it a chronic condition? Is it a condition that has to be treated lifelong? Most adults, when they are diagnosed with ITP, are either in their 20s or 30s or sometimes even slightly older, but more common in the 20s or 30s or 40s. And as I said, it happens because of immune dysregulation. Most of these patients need to take medications for at least up to a few months to a few years. It depends. The duration of treatment depends on how much antibody is there, so how active their immune system is. Usually we start off with medicines called steroids. We use other medicines called romiplostim, rituximab. Sometimes we use a tablet that is called azathioprine. So with the help of varying small amounts of one of these medications, or sometimes a combination of various medicines, we try to keep the condition under control. So it is something like your diabetes or hypertension, where you have to take medicines for quite some time, but it cannot be completely cured. In some cases, when the antibody load actually comes down and the immune system sort of resets itself, even when we reduce the dose of these medications, the body tends to maintain the blood counts. And then we can consider that that patient is cured of ITP. So to put it in a small nutshell or summary, ITP is not a life-threatening condition always if your platelet counts are maintained, especially above 30 to 50,000 and higher. But with ITP that is not treated, if platelet counts drop under 20,000, under 30,000, especially if there is an injury, as I said, either to the head or to the abdomen, it can be a condition that can be life-threatening because of the amount of bleeding that can happen. If you have any other questions about ITP or any other blood-related issues, please feel free to reach out to me. I'm Dr. Neema Bhat, hematologist at Helios Cancer and Hematology clinics. Thank you.